I'm Anna Maria Viti-Welch, and I am president of the Viti Companies. I've been working for my family business for 32 years. Some days were good, some days were bad, meaning eating, all kinds of junk food and then feeling guilty like most people and then trying to eat salads. So really not working on my health very much. I didn't think I would have any heart issues because my cholesterol was about 140. Every time I had a life insurance exam, I'd be preferred, so that means that my blood pressure was wonderful also. And every time I would go to the doctor, they'd say, my gosh, do you exercise? Your blood pressure is phenomenal. So really, I did not feel like anything would happen. I never really thought of heart disease being anything for men or women. I would hear about it, but I really didn't think that heart disease would affect me. I was sitting at my desk on a Friday, just coming off a 2-week vacation, walking 4 miles a day, probably not eating and drinking the best. And this overwhelming feeling came over me, and I just could not sit still. I went into my assistant's office and asked her, do I look kind of pale? Take me to the hospital, because I'm only about 2 minutes away, which was not a very good decision, because I should have called the ambulance, but I was embarrassed. I was embarrassed that my staff would be like, oh my gosh, what's going on here? What's wrong with her? And what if it wasn't anything? They gave me an EKG, nothing was wrong, they said, and they did, though, want to know what was wrong because I was not feeling any better as I stayed there, a little bit longer. So they did take my blood and my enzymes were elevated. So that's how I discovered that something was wrong with me. When they gave me the results, I was shocked, and I really didn't believe it because I told them it's Friday and I can't really stay here because I have a lot of work because I've been gone for 2 weeks. But of course, I stayed. When I was going to go home, I had my cardiologist nurse came and spoke to me and gave me all this different information, and told me to really take it easy for a week and go home and read the information that they gave to me. And I did do that, and it scared the living heck out of me. And I didn't really want to eat anything at all, but I started researching and decided that I really had to change the way I ate. I will tell you though, if somebody told me this was going to happen, I probably would have never believed it. But like I said, wish I would have continued to work out more consistently, try to eat better consistently, and again, really tried to stay home a little bit more instead of running around and trying to help others. I think if I gave some information to women, I would say that being a mother and being a caretaker and also running a business or having a career, you really have to balance and take that word balance literally. Not, oh yeah, I have a life, work balance. You really need to think about what that means to you and to your health. Because just going home at night at 8 o'clock and going to bed at 9 or 10 like I do, I did get enough sleep. It just wasn't enough. I really think that you need to really exercise more and make time for it, which I didn't before. I felt that going to work earlier was more important than exercising, or even coming home early and exercising. Don't feel guilty. Also, you have, a family, and really maybe spend more time with them than, oh my gosh, I need to get another piece of business. I joined the Gaples Institute because, first of all, it was an amazing story of Dr. Steve DeVries, what he did. This cardiologist who had a 9-month wait and really wanted to help the public and also the medical field learn more about what nutrition is all about and how important it is to your health. I mean, that was really an unbelievable story. The gap I feel that the Gaples Institute is filling is really getting the word out to the public, or at least trying to in different ways, on how to eat healthy. I just think that people don't understand what that means. When I see people and they know, they can't believe, first of all, that I've ever had any heart issues, I just tell people, first of all, it is the #1 killer for men and women. And really, you don't have to just cut back 100%, just really try to, because again, you don't want to have a symptom, and then if you do or have heart issues, it's going to make you eat properly. It's going to make you dial down quickly. So do it on your own time, not because you have to.